This slideshow presentation will be focused on Wernicke's aphasia and is presented by Hannah Hudson and Brooke Wilson. So, what is aphasia? Aphasia is an acquired language disorder that is caused by a brain injury. Aphasia affects every aspect of language. This includes speaking, listening, reading, and writing. Aphasia is not the result of an intellectual, sensory, motor, or psychiatric problem. Aphasia is a loss of language, not a loss of intellect. There are several types of aphasia that include Wernicke's, Broca's, conduction, global, transcortical sensory, transcortical motor, mixed transcortical, anomic, primary progressive, cross, and subcortical. But the one we will be focusing on in this PowerPoint is Wernicke's. Wernicke's aphasia is a classic aphasia syndrome that is associated with a lesion in Wernicke's area, which resides in the temporal lobe. Wernicke's area also corresponds to Brodmann's area 22. People with Wernicke's usually have typical speech output that sounds fluent. However, Wernicke's is also called jargon aphasia because of the tendency to produce neologisms. Neologisms are literally new words that the patient is saying. For example, a patient with Wernicke's might say, "Bring me a trunket" instead of "bring me a drink." Another feature of Wernicke's are paraphasias. This is a word substitution. Paraphasia types include semantic, which is a substitution of a real word for a target in the actual word that wants to be produced. For example, saying ear instead of nose. Phonemic paraphasias include a sound substitution instead of the real word. For example, saying baby instead of baby. In this diagram, Wernicke's area is represented in green. Recent research, however, shows that actual areas associated with Wernicke's aphasia not only include Wernicke's area, but other parts of the left temporal lobe, including the anterior portions of the temporal lobe as well. These include the posterior middle temporal gyrus and the posterior superior temporal sulcus, plus parts of the inferior frontal gyrus, including Broca's area and the middle frontal gyrus and dorsal premotor cortex. This slide will be focused on the etiology of Wernicke's aphasia. Brain injuries are the leading cause of Wernicke's aphasia. Lesions or damage in the middle of the left side of the brain is the main cause for this disorder. Stroke is one potential cause because it blocks blood flow to the brain. If blood cannot reach Wernicke's area, cells start to die, resulting in aphasia. Aphasia affects 25 to 40% of people who have a stroke, and other brain injuries that can cause Wernicke's include head trauma, TBI, or traumatic brain injury, tumors, infections, and neurological disorders. Symptoms of Wernicke's include stringing words together that don't make sense and making up words that have no meaning. Patients that exhibit Wernicke's aphasias may be unaware of their speech errors and are able to fluently articulate even though their content does not make sense. They also have difficulty repeating and will also exhibit difficulty with reading and writing. Patients with Wernicke's aphasia will also show poor self-monitoring and lack of awareness. This slide will indicate the purposes of assessment for Wernicke's aphasia. It is important to support initial and ongoing intervention through building rapport, counseling, and motivation. The clinician needs to determine whether the client has one or more communication disorders and also determine the nature of each of those disorders. The severity of language and other cognitive abilities should be described, as well as the impacts of these impairments on daily life for the patient. Once assessment has been finished, a prognosis should be made along with an intervention plan and goals for treatment. For the assessment of Wernicke's aphasia, one of the most well-known aphasia assessments is the Western Aphasia Battery, or WAB. The WAB can be used to assess people with aphasia due to stroke, TBI, and people with dementia. Some of the areas that the battery assesses are fluency, comprehension, repetition, naming, word finding, reading, writing, and drawing. Other areas that are assessed are calculation, praxis, and differentiation of deep, surface, and visual dyslexia. The assessment results help narrow which aphasia classification should be diagnosed. The full battery takes different lengths of time depending on what all is assessed. The bedside form only lasts roughly 15 minutes, while the full battery can last 30 to 45 minutes, up to an additional 60 minutes for the reading and writing and praxis sections. This slide will focus on the intervention of Wernicke's aphasia. Intervention is an action taken to improve a situation. When planning intervention, there are a few things that need to be kept in mind. The therapist has to acknowledge that communication is a fundamental human right. The therapist must also be client-centered. Including family members is an important aspect to help the client engage in communication with familiar people, and treatment goals must have a clear purpose. The therapist also must focus on the client's strengths rather than their weaknesses. For intervention for Wernicke's aphasia, the Life Participation Approach to Aphasia, or LPAA, is a social treatment approach that puts the holistic life concerns of people with aphasia and those who are important to them at the center of decision making and intervention. LPAA recognizes that communication problems affect interpersonal bonds and virtually affect every aspect of one's life. Therapy for Wernicke's aphasia will focus on all aspects of language that includes speaking, listening, reading, and writing. We hope that you learned a little bit about Wernicke's aphasia from this PowerPoint presentation. Thank you so much for watching.